All right. Hey guys, welcome back to episode 19. So we are here today with Kim Broussard, and I am so excited to talk to Kim. So Kim is actually my certified fertility care practitioner, and we'll get more into it a little bit more about what she does and all that kind of stuff. But so Kim is an active member of the American Academy of Fertility Care Professionals and director of fertility care of Fort Bend. So Kim also provides instruction in the Creighton Model FertilityCare System, which helps women and couples track their menstrual cycles, uncover underlying hormonal abnormalities and causes of infertility. So she has been a user of the system for 13 years and credits the system for her improved health and successful second pregnancy. Kim's mission is to provide fertility awareness and education in reproductive health to women and couples of all ages. It is her belief that this awareness and education allows her clients to make decisions in cooperation with their natural fertility that results in an overall increase in health and wellness. So a huge welcome to Kim. Thank you so much for joining us today.
Thank you so much for having me. It's my pleasure.
Yeah, we're excited you're here.
Thank you.
All right. So typically we always start the show with what are you loving right now?
Okay.
So what are you loving right now, Kim?
I think we've talked about it a little bit before, but I'm really digging my journey and dive into the keto diet. 6 weeks strong at this point and seeing some vast improvements in gut health and gut happiness and weight loss and body fat loss and just overall feeling really good and really enjoying the foods that I'm eating and kind of figuring out those macros and how to make little adjustments here and there.
That's awesome. I know keto, I feel like keto is so hot right now, but I feel like so many people are doing so well on it, which is so cool. So what are like some of your favorite recipes? I'm kind of just curious, like what are some of your favorite meals?
Yeah, well, you mentioned, it's kind of hot right now, and I actually was really hesitant to jump on the keto bandwagon because it is so trendy at the moment, and I don't really like to jump on things that are trendy. So I kind of was resistant to it, but after enough research and talking to my husband, we just really felt like my body would probably respond well to it. And working with our nutritionist, he helped me really map out my macros the way that they needed to be, which is something that I need help with because I'm not good at all that stuff.
Mm-hmm.
I don't really have recipes at the moment. I'm just kind of eating the same stuff every day, but I am loving the chicken thighs and the beef tenderloin for dinner. And avocados are in season, so they're just really good right now. And just, enjoying what I'm eating, feeling like I'm eating enough of what I'm eating, and curbing that appetite throughout the day, just kind of feeling good. I haven't felt like I've ever met those needs before until now.
Yeah. And it's pretty cool too, once you start eating just a little bit more of that fat, getting that more like satiated feeling to where you're full, but also it's just like pretty cool because it could be something that your body was just lacking for so long. So now it's just loving the nourishment that you're getting. And bonus on top of eating like all of those fattier pieces of meat that are just so tasty and delicious. So I don't know if you've done this yet, but one of my like favorite high fat meals, especially you talk about like the beef tenderloin. So I actually will take like the pork loin, like the long pork loin, and wrap it in bacon with some rosemary. Oh my gosh, people. Yeah, it is super good. So try that for one of your meals moving forward because it's really good.
Yeah, I'm looking for some variety. So I kind of hit the ground running with one plan and didn't want to move too far from it just to start out. And so now I'm kind of starting to look at some different options for food combinations, and my nutritionist is actually making me a second plan so I can have some variety with what I'm doing, because I will get kind of bored after a while, so I need to have some options and choices there for the long term, or it won't last because I just know myself. Yeah I
mean, you got to have variety. You can't just eat the same thing all the time. It gets boring. So
for sure.
Yeah. Well, that's awesome. I'm super excited to hear that. And I know before the show, we were even kind of talking about how maybe later on we can dive more into like your story and kind of what you're doing with keto and stuff, because it's just super interesting. So I'm really excited to hear how you're doing in the future with that.
Great. Yep. Will do.
Cool. So, okay, so we are here today with Kim because I really wanted to talk to her a little bit more about kind of what she does. So, being a certified fertility care practitioner, so Kim is actually kind of showing me the way, shining the light for me. I've had a lot of fertility issues that I've struggled with in the past. I guess that I didn't even really realize that I had until kind of recently. And so just kind of had my own stuff going on with having some issues with my periods and some other stuff going on. So I was like, man, I really need some help and some guidance with this. So I actually have a couple of friends that have been working with Kim, and they kind of, obviously recommended me to her. And so I started working with Kim, and the Creighton model that she is teaching me how to track my cycles with is just so amazing, you guys. So, I am kind of like I guess, standard case of like, I was on birth control for 13 years. And then when I went through the NTP course, which I know we've kind of talked about on the show, so you guys are kind of familiar, but I went through the NTP course and I learned about, taking artificial hormones and really what they can do to your body and how they can just super mess with you. So I stopped taking birth control last January. So it's been about a year and a half. And face freaked out, gained some weight, just all this stuff. And I was like, man, I got to figure out what to do. Kind of taking care of myself, not doing artificial contraceptives and all that kind of stuff. And so I kind of tried it on my own for a while, but I really just needed some professional help. So that's when I reached out to Kim, and she's just been so awesome teaching me this model. So I really wanted to have her on so that we can teach all of our listeners about this model, because I just think it is so cool. And I think that for every woman out there, they need to understand the way that their body works better. Because I think that's one kind of fault, I guess, in our system is like, I didn't even really understand how the cycle worked and the different like luteal phase and follicular phase and all this kind of stuff. And like, kind of checking out like your cervical fluid. I was like, what? It changes throughout the month? Like, I didn't even know all of these things. And as a woman, I mean, you should. So Kim's really been helping me with that, and I'm just super excited to not be on birth control and to not be having to use condoms and other contraceptives when I, have that special time going on. And it's just cool. It's just taking responsibility for my own body and not having to put anything artificial in it at any point, which is amazing. So, Kim, kind of tell us like a little bit more about this Creighton model that we've been working on together. I guess really kind of like the role of fertility awareness in overall health as opposed to like artificial birth control, and kind of like how this system comes into place.
Okay, for sure. There's a lot there, so there's a lot that can be discussed. But I'll basically summarize kind of what the Creighton model is, and how I got involved in it, and the kind of the training that I went through to become a teacher of the system. So I myself struggled with my own infertility issues, diagnosed with PCOS at 19, but knew prior to that, starting at about 15, that my body wasn't doing cycles like my friends were, just something was off, and never got officially diagnosed till 19 after going to 3 different OB-GYNs who wouldn't take me seriously. And finally, the third one just did a simple blood test, said, yes, you're classic PCOS, you have high testosterone, you have low progesterone, everything's off. And she said, you just need birth control because that'll regulate your cycles. I was 19, I was in college, went, okay, that sounds good. I don't know any different. But I had also met my now husband at the time at 19. And he and I talked about it, and he had some religious convictions about artificial birth control. Being devout Catholic, that was not something that was going to be part of our marriage if we moved forward to getting married. So he said, yeah, I don't know if that's the best option for you. From what I understand, artificial birth control just isn't good for you. And if we do move forward to getting married and wanting to have a family, we're not going to be using birth control. So we need to come up with a different solution. And I didn't really want to be on it anyways. And it didn't make me, I had taken it on and off throughout my late teen years, and I just didn't feel good on it. So kind of moved forward, didn't really do much of anything, still had irregular cycles. Fast forward, we get married when I'm 22, and I didn't do anything. We just knew that it may be challenging to have a family, so we started trying to start our family right away. And I didn't have a menstrual cycle for 3 years. And I went, okay, that's not normal. And And I went to a regular OB-GYN, and she tried metformin for PCOS. That just made me sick. It didn't help anything. I did a couple rounds of Clomid to help induce ovulation, and I did not achieve pregnancy. And so she handed us off to a fertility specialist, an IVF doctor, which was another place that we didn't really want to go. But we found ourselves there, and after a few kind of poorly run tests, he said, well, both of you have an issue. If you don't do in vitro, you will never have biological children. And so I went, well, I don't know if I agree with that. And we kind of coped with that. I decided to get a better teaching job, save up some money, and we would start pursuing possible adoption to grow our family. And then 6 months later, spontaneously was pregnant with our first daughter. No intervention whatsoever. So obviously I could get pregnant, and I didn't need any of those additional things that he was offering. Pregnancy was pretty good. I did have a hemorrhage at 10 weeks, probably due to low progesterone that wasn't being monitored, and I know now. So anyways, fast forward, have her, good labor delivery, everything was fine. Went from having no menstrual cycles to giving birth to her to having menstrual cycles every 2 weeks, and sometimes bleeding for as long as 14 days. And severe PMS. I mean, I just lost my mind pretty much. And we had moved overseas to Australia with my husband's job. So I was on new mom, other side of the world, hormonally crazy, thinking about trying for another baby, but I was bleeding all the time. So we're like, how is this going to work? And he came home from work one day and said, man, I don't know what we're going to do, but you're not the same person. Like, you're not happy. You're not who I married. And I just went, yeah, I don't feel good. Gained a lot of weight. It just felt terrible. And it just happened that the one fertility care center in the country of Australia was about 10 minutes from where we were living. And I went, I had heard of the program, but then I got pregnant. And I'm like, oh, I can get pregnant. I don't need it. This is great. And then my body went crazy. So I thought, okay, I'm supposed to go see these people. Like, I think we're living in Australia for more reasons than I realized. And so I went to see them. And just in that first class, I remember saying to my husband afterwards, man, everybody needs to know this. Like, this is the greatest information ever. Why are we not taught how our body works? Like, I never knew the menstrual cycle, the phases of the cycle. I had no idea what the role of cervical mucus was. And I had already had a baby. I had no idea why it was there. And so they really taught me and helped me understand, well, your body should be doing these things. You're not doing this at all because your hormones are all over the map. And when they finally did some blood tests on me, I was manufacturing 0 progesterone. I wasn't ovulating on my own, and I wasn't having any progesterone hormone, which is why I was having such severe PMS and this erratic bleeding. So once they determined that, they got me on bioidentical progesterone supplementation. And that started regulating my cycles and helping me feel, I literally after the first injection of progesterone that afternoon, I went, oh my gosh, like, I'm back. I felt just back with the world. I felt amazing. So that got me thinking, like, how can I get this message out to everybody else? Because this is life-changing for me. I don't know if we'll ever have another baby, but just knowing what was wrong with me and being able to get it treated and being healthier and the hope of a possible another pregnancy just changed my life. So I began thinking, I should probably teach this. This is a good deal. In the meantime, we moved back to the States, and we did not have any local doctors here that were trained in the system. So I had to work with my own health remotely with the main doctor in Omaha, Nebraska. And during that time frame, I thought, well, I don't want to go back to work full time because I want to be able to stay at home with my daughter. What could I do that would be fulfilling for me and provide a little bit of income and just really give me something to do. So I decided to do the training program. So all of us that are practitioners go through a 13-month internship. It's a full immersion course. So the first phase is you travel to wherever it's being held for about 10 days, and you do just a massive amount of learning and studying. And then they send you home with a supervisor, long distance supervisor, and you do a 6-month practicum, and you have to meet milestones through that practicum. And then you go back for another 8-day immersion course, and then another 6 months of practicum, and then a final exam. And then once you've completed your internship, and during that intern phase, you can start seeing clients and start kind of building your fertility care center. So I embarked on that in an area where there wasn't really anybody teaching, and I had the support of my church financially. He kind of took a risk with me and said, yeah, we need this. I'll pay for you to do this, but we'll see how this goes. And he never said anything, but every once in a while he would check in, like, how many people do you have? How many people do you have? And I kept telling him the numbers, and he was just floored. Like, I didn't think you would get this many. This is amazing. I said, well, it's great. Women just want this. It's what they need. So my numbers grew exponentially. About 4 months post final exam, I was able to apply for certification, and I've been a certified practitioner since then. So I've been teaching for 10 years. I almost have 500 clients. I'm almost there to that huge milestone, wow, which is awesome.
Congrats.
Thanks. I pretty much work full time. The beauty of it is I'm an independent center, so I can set my own hours and be with my kids when I want to be with my kids. What's great now is we have 4 doctors in the Houston area that are trained in this system, and they are also surgically trained. So they took an extra year of surgical fellowship training. So they are highly specialized with what they do. There's only 15 surgeons in the country, and we have 4 of them here in Houston, which is amazing. So I've got a great support system with them, and we kind of refer people back and forth between learning the Creighton system so that they can help identify and uncover issues with them in their office there.
That's super cool. So now what are the surgeons doing specifically beyond like what you're doing as a practitioner?
So the surgeons specifically will take they require me teaching these women and couples how to chart their cycles. And I kind of skipped over that. But basically what I do is I teach you a standardized way to track your menstrual bleeding and your cervical mucus secretions. So we are what's called a mucus-only method. Mm-hmm. So we don't require any basal body temperature taking or internal cervical exams or any of that kind of thing. It's just a simple check every time you go to the restroom to look at cervical mucus discharge, and then track it with our standardized method of tracking. So I guide you. My job is to teach that to you and guide you through that process to make sure you're tracking and documenting everything correctly. Mm-hmm. Those charts serve as a foundation for what the doctors can do. They have to have that data in order to assess what may be going on. Bleeding patterns are uncovered. Lack of mucus or overabundance of mucus is uncovered. The entire phase length from start to finish is uncovered, and they can glance at a chart and say, well, you're already showing a pattern that's indicative of polycystic ovaries or something like that. So those charts are their foundation for everything that they do. Mm-hmm. Once they do that, then they can order timed blood tests. So instead of just picking a random day to check your hormone levels, they will do pre and post-ovulatory checks based off your chart. So it's very specific to your cycle and your body and what it's doing. So it gives them a really accurate picture of the rise and fall of your hormone levels throughout the whole cycle. Mm-hmm. And then they can do also timed ultrasound series to look at follicular development and actual ovulation taking place. And then after they've done those things, then they can also treat you by timing those medications specifically to your cycles. So you're taking medication only when you need it, and specifically amounts that you need. So they're not over medicating. They do use some medications that mainstream medicine uses, but they typically use them in different doses and smaller doses because it's timed specifically to that woman's cycle. The surgeons take it a step further. So typically surgery is kind of the last resort. So they will look at charts and do all the testing and treatment of things. And if that still isn't really improving your health, or a couple is still not successful in achieving pregnancy, then it may be worth doing some type of laparoscopic surgery to take a look at things that are going on inside that can't be seen from a chart. So they use robotically assisted laparoscopic surgery to go in and look for things like endometriosis, adhesions or scar tissue that are affecting the reproductive organs, polycystic ovaries. They can do a surgery on the ovaries to reduce them to more normal size and remove cysts. They look at inflammation inside the uterus, blocked fallopian tubes, all kinds of stuff. But what they specialize in something called near adhesion-free surgery. So they have trained very hard to make sure that when they're in there removing endometriosis or whatever they find, that they're incredibly precise and careful with what they're doing so that they're not going to cause a secondary issue post-surgery. So they're really only doing things they need to do and doing it with precision so that it doesn't impact fertility in the future.
That's fascinating. So it's kind of like the bioidentical dentist that we have nowadays. So like, I guess the standard of care for getting like your wisdom teeth removed, they actually leave some sort of like membrane on there. So now people are starting to have issues where that like will rot. And then they'll having to go back and get a cavitational done to get that bone, like the decaying bone taken out. So it's kind of sounds like what these doctors are doing when they're doing these procedures is it's very like more, functional, kind of the bioidentical type way. So that's super cool. And I guess, the main thing that sticks out to me is like, it's just so crazy that even being a woman, not understanding my own body the way that I feel like every woman should, it's like the things that they teach us in science class don't even touch upon the things that you've taught me. Like learning how to understand, your cervical fluid and at different times of the month and throughout your cycle, just how it like varies and understanding how to read that kind of stuff. It's so fascinating to me. And it's also just so sad to me at the same time that this, like, I've literally been tracking with Kim since, let's see, April 23rd. So not that long ago, I did not understand my body the way I do now. And so I think it's really cool. And I wish, more girls were aware about this kind of stuff. But so I guess like another thing that I wanted to kind of ask you since we've got you on the show is, can you kind of just take the time to explain a little bit more about like how a woman's cycle is supposed to work? Just so people can kind of understand that just to like a very, basic degree.
Sure. Yeah, I can give you kind of a basic, what a normal menstrual cycle should do. So you should all, one thing in the Creighton model that we try to do is we don't speak in terms of monthly cycle, because your cycle length will vary. So we just talk about them as cycles when they come. So every cycle, you should have a menstrual period. The menstrual bleeding is the shedding of the uterine lining that progesterone hormone has developed. So progesterone in your body will build the lining of the uterus to make it thicker and healthier so that a baby could implant and grow there for the next 9 months. If you are not pregnant, then your body is supposed to shed that uterine lining. That bleeding can range anywhere from 3 to 7 days is the norm. Average is about 5 days. So most women have a menstrual period for 5 days. Your menstrual bleeding should have a pattern to it. It should either start out kind of heavy and decline till it stops, or it should start out kind of light and build to a moderate heavy flow and then decline again to a light flow until it stops. So that's a healthy type of menstrual period. After your menstrual bleeding, you typically have a couple days where there's no discharge really being seen. your body is starting to produce estrogen and start the ovulation process. So once it starts getting estrogen to a higher level, you will start to secrete cervical mucus. Cervical mucus helps sperm stay alive. So as your estrogen is rising, your cervix is changing shape, and it's secreting this mucus because it's getting ready to open and receive sperm to help you conceive a child. It's the purpose of cervical mucus. I remember being a teenage girl going, what is this stuff? I don't know why this is here. This is really horrible and uncomfortable, and I don't like it. Now I know.
Am I dying? What's going on?
What's going on?
Yeah.
Now I know it's super important, and
Yep.
it's a sign of good, healthy reproductive health. So it's a good sign that you're having this cervical mucus. Your cervical mucus, as you approach ovulation, will change. It will become stretchier. It will become clearer in color. It will feel more slippery and lubricative. It's supposed to do that. We call it your mucus cycle. It should have this nice buildup, becoming the most fertile type of mucus you can have. Once you ovulate, once that egg is released, the estrogen production pretty much comes to a stop. It will kind of plummet, and the mucus dries up. Fertility is over, and the second phase of your cycle starts. So you ovulate, estrogen drops, and then progesterone takes over to develop that uterine lining so that if pregnancy did occur, that baby can make its way into the uterus, implant in the lining of the uterus, and continue to grow for the next 9 months. Mm-hmm. And if you're not pregnant, then you have another menstrual period and the whole thing starts over. That should take, on average, 28 to 32 days. Mm-hmm. But we have ranges of normal. What we really want to see is consistency in your patterns. So some people may be 28-day cyclers, and other people, their norm may be 42. And that varies because of when they ovulate, because your ovulation will move around. Not everybody ovulates day 14 of their cycle. Mm-hmm. In fact, very few people do.
Yep.
So what we want to see is we want to be able to identify when you're actually ovulating, and is the rest of your cycle consistent in those phases, and consistent between cycles.
Mm-hmm. So cool. Yeah. So, and then kind of like what I was talking about earlier with just kind of the different signs that you're getting, the biomarkers that you're getting throughout your cycle. So that's also what, Kim is, a practitioner to train women how to read that cycle so that you can know when it's safe to have intercourse and when it's not safe. Well, I guess I should say, in the purpose of kind of what you're using the model for. So if it's to get pregnant or to avoid pregnancy, then you would use those different days on achieving pregnancy or not. So avoiding it, that kind of thing. So it's really interesting. So especially like the one thing that I guess I wasn't aware of. So those days where, we have our cycle, and this is just kind of, what I've taken from it. So hopefully someone can learn from it. So those days where we have this mucus that Kim is talking about, where it's like you wipe and it's like a slip inside and you're just like, what is all this stuff coming out of me? Kind of how she was talking about, those are like your most fertile days. So those are the days that you want to use to either get pregnant or just avoid intercourse so that you will not get pregnant. And I just thought that was so fascinating because for the longest time, I just thought I could get pregnant the entire cycle. I didn't know that we had days of fertility and infertility. So that was like the coolest thing for me to learn, and especially just like reading that mucus and, when that kind of time of the month is. So hopefully just.
Yeah, I work with a lot of clients that are dealing with infertility. And for some people, it's a timing issue. They've been told you're supposed to have a 28-day cycle. You ovulate day 14. So those are the days you need to target for intercourse to help you achieve pregnancy. Most of the time, that's incorrect. Coolest experience ever. This is why I keep teaching. Yesterday, actually, had a couple, an Indian couple who the wife barely speaks any English. It was really a teaching challenge for me, but her husband is amazing and he would translate stuff. And we had a hard time because a lot of the words don't translate into their language. It's hard to describe mucus in their language. But he did a great job. And he had texted me about 2 weeks ago, and he's like, I think she may be pregnant. She's 40. I think he's probably early 40s also. Never had a pregnancy. And he said, what do we do? And I said, well, wait till this particular day. If you get to that day and she hasn't started a menstrual period, then take your pregnancy test and let me know. And so he texted me back a couple days, and he's like, I think she is. And he sent me a picture of the positive test. And I said, oh yeah, she is. Call the doctor, go talk with her, and then get back with me. So yesterday they came, because I do pregnancy evaluations, and I date their pregnancy off the time of conception and give them an estimated due date based off of that instead of last menstrual period, and watch them closely through the pregnancy. And they had just come from their first ultrasound, and the first time ever, I'm going to get all choked up. The first time either one of them had ever heard a baby's heartbeat on an ultrasound, and it was their own baby. And they were just on cloud nine. It was just amazing. So excited. And at 40, first pregnancy ever. And it was timing for them. It was understanding her cycle. They had only charted a cycle and a half with me. So she got pregnant basically her second cycle of Creighton charting at advanced maternal age. And that's a big deal.
Yeah. So they had obviously been trying to get pregnant for a while.
Yes, for a little while. Yep.
That's awesome. Wow. What a stud you are, Kim. That's great.
I don't know how much I had to do with it.
I mean, a lot. I mean, this system is really like changed my world, and I know it could do the same for a lot of people. Whether they're out there just struggling with infertility because they're older and it's kind of this whole timing thing that you're talking about, or it's, someone with PCOS, or they've been on birth control for so long, or they have irregular cycles and they don't understand why. I mean, this model can really just make the world of a difference for any female out there. And I just feel so blessed to have found you and found this model and this system. And sorry, go ahead. What were you going to say?
I like to really refer to it as, a fertility awareness, women's health model, because it's so much more than honestly family planning. It started out kind of as this form of natural family planning that kind of has a negative connotation sometimes to a lot of people, like, oh, natural family planning means you're going to have 10 babies. It doesn't work that well. But it's really so much more than that. And family planning is kind of like an added bonus to what you're doing. Like charting your cycle and understanding and improving your health is so valuable. And then being able to take that information and work together with your spouse on family planning as an added bonus to that is amazing. And I know for us, it's been a great line of communication and watching my body and my health improve after learning the system, being treated for all the issues I had going on. And then being able to get pregnant with the second baby and know exactly when we got pregnant, and that we chose that. And we know that we created her together because we wanted to, and that was our goal at that time. And it's a different aspect to that part of our marriage and our life. And it's so very informative. And another big portion of what I do is I teach this to young girls. Like, this is so important that they learn from before they start having menstrual periods, what's going to happen and why it's going to happen, and the purpose of it. And it's not something to not discuss. It's not something to be afraid of. It's actually really beautiful. And your body is meant to have a menstrual period every month. You're not supposed to take these medications to suppress it and turn that off. And it breaks my heart to think that these young girls start having menstrual periods. They don't really understand what it's for and why, and it's not really respected. They decide to go on birth control, or they're advised to go on birth control because of bad menstrual cramps or acne or something like that. And there's an underlying reason for those things. There's something going on that is causing them to have these side effects and these symptoms. But they don't get it diagnosed. And they stay on this birth control pill, sometimes upwards 20 years. And then
that was me. I stayed on for 20 years.
That's incredible to me. And then a lot of them go off of it because they meet who they want to spend their life with and start a family, and they can't. Their body's not working and they don't know why. They just thought, well, I'd stop taking birth control and I'm going to get pregnant and it's going to be wonderful. And they just can't. And so the rates of infertility are skyrocketing from prolonged birth control use. Cancer rates are going up, and women's health. There's so many issues. And I get women too that come to me and they're like, I feel crazy. Like I don't feel right. And I said, I guarantee you've got some type of hormone dysfunction. Something is out of equilibrium and we need to figure out what it is and get you back to where you're supposed to be. And, after going through the process and getting the treatment, when they come back to me, they're beside themselves. Like, everybody thought I was crazy. I thought I was crazy. Nobody would listen to me, but you were right. I had hormone dysfunction and now I'm taking good hormones to get myself back on track. And I feel like a brand new person. I'm a better mom. I'm a better wife. I can function in the real world. I don't have this extreme anxiety, sleeping better, just everything is greatly improved because they're back where they're supposed to be instead of just being all over the map. So yeah, so important from an early age. I mean, my daughter will testify, she's 13. She has been more than prepared for tracking her cycles. But it's so open in our family. Like we talk about it all the time. And she knew it was coming. She didn't know when, but she was ready and waiting. And when her first cycle happened, it was no big deal. She had that normal girl reaction, like, oh, here we go. Because I don't think anybody really looks forward to it. But she knew exactly what to do. She came and she told me, and I said, okay, did you take care of it? Do you need any guidance, any help, anything like that? She's like, no, I think I'm good. And I kind of track them for her right now because they haven't regulated. So I keep track of kind of watching her health for her. Probably in start of the next school year, I'm going to have her do it because I think it's important that she take ownership of that and really start tracking her own cycles. But I'll give her a heads up, like, okay, it's probably about a week. Probably next week is going to be when you have another menstrual period. So make sure you have all your supplies in your backpack or wherever you're going to be, so you're not caught off guard. And it's really removed that fear for her of, oh my gosh, I'm going to be at school. I'm going to start my period in the middle of class and I'm going to have to get up in front of everybody and take care of it. And she hasn't had that aspect of it like I did growing up, and that fear. And so I'm really passionate about teaching these young girls about this and trying to get that information, the right information in their hands so that they aren't afraid of what they're dealing with and they know how to deal with it.
That's so powerful, because I was definitely one of those scared girls. Like when I started, I was like, what do I do, Mom? Like, what am I dealing with here? I mean, I obviously was a little bit aware, but not like super aware. And then I also just had crazy cramps when I was younger. And it was just a miserable experience for me. And my mom would like pick me up from school because I just didn't feel good. I was like curled up in a ball. And so I just, it's really powerful stuff to just kind of educate this at a very, very young age so that this is like a natural process and they're educated about this kind of stuff and they can make smart decisions, based on their health and kind of how to move forward with that kind of stuff. So
right.
I wish they would teach this in schools.
I'm trying.
I was just thinking that.
I actually teach, my daughter goes to private school, so I have a little bit of flexibility there, but they had invited me a couple of years ago to start doing the 5th grade puberty discussion because they didn't really have a program. So I started doing that for them, and it's one of my favorite days because you've got these girls that most of them have not started their periods yet, so they're still retaining some of their innocence, but they also want to be older. And so it really opens up a great discussion. I mean, they ask some wonderful, sometimes difficult questions that I have to deal with, but you can tell they're like, okay. Some of them are giggly and, I say all the real words. I pretty much started out like, okay, I'm going to say vagina and mucus, and everybody laughs and we get it out of the way. And so it's important that they understand the real terminology too.
Yeah.
And that again, it's nothing to not discuss and to be afraid of. This is our body. This is the way we're made, and this is how it's meant to function. So let's understand why and why it's doing this, and be more than prepared for when that time comes.
Mm-hmm. Mm-hmm. Yeah, that's the other issue is people are so like giggly and immature about the way that our bodies are supposed to function and the parts that we have. It's like, why? Like, don't put that energy around that kind of stuff and just be cool with it and have open conversations about it like we should be doing, especially with our younger kids. Because, I mean, that just distorts that mental picture for them growing up, and then they have to figure it out for themselves. So that's awesome that you're doing that.
Mm-hmm.
You need to invent like some sort of online program that people can like just walk themselves through, so that because you only have two hands and one mouth. So like seriously, something that people could like do this and like learn themselves, and then obviously have like your coaching or guidance. That would be so awesome. Just to get this out there to like more people, the masses.
Yeah. And, one of the things that our program has struggled with a little bit over the years, the program itself is over 30 years old. The issue is there wasn't a whole lot of funding for the marketing side of things. So the program is a little bit stuck in the early 80s. Kind of technology is lagging a little bit. I'll be the first to admit that. But there's also something about old school pen and paper charting that works really well. So I don't know if we need to change it too much. Like, I don't know if we really need to go digitize everything. I think there's value in still writing things down. But they spent all their time and money developing a really awesome system. And the medical side of it was actually something that the founder never wanted to dive into. So the doctor that founded this, his name is Dr. Thomas Hilgers. He was an OB-GYN, and he just found that there needed to be a more reliable system of natural family planning. The stuff that was out there, just couples couldn't rely on. And so he developed the Creighton Model System. When he started getting enough women charting, he realized that certain conditions were following certain patterns on the chart. And he went, oh, that's interesting. All of these women have PCOS and their charts all look the same. That's kind of cool. I can use this in my practice as a diagnostic tool. And it just blew up from there. And he developed something called NAPRO technology. That stands for Natural Procreative Technology. So our doctors use that technology, 100% natural in everything that they do, to uncover the underlying cause of whatever problems are going on and treat them 100% naturally too. So their philosophy is to figure out what's wrong first, correct that, make it better, improve your health, and then move you towards successfully achieving a pregnancy, and a very healthy pregnancy and healthy babies on the other end. So that's kind of how the whole thing came about, in terms of being just a family planning program to then developing into a women's reproductive health initiative. But that took a lot of time and a lot of money. And so marketing wasn't there. It's kind of changing. There's more of us that have been trained. So there are people all over the world that do what I do. A lot of us teach long distance. So I can teach the whole system through the computer, through Skype, FaceTime, Google Hangouts, whatever. So you can always find a teacher in the system, but it's super important that you work with a teacher, because it is not a self-taught program. You really need us to be there kind of holding your hand. Megan, you know this, to help guide you through those early stages of charting, because it's confusing. And if you don't understand what you're doing, and you are in a relationship where you're choosing days for intercourse, you may choose a day that wasn't the correct day, and then find yourself in a situation that you weren't ready to be in yet. So it's important that you work with us so that we can walk you through the steps of the process to build your confidence and get you to a point of understanding of how to select days for intercourse based on what your goal is. Yeah, that is a really good point. Because I know I've needed your help more than ever with this. I'm just asking you about like certain days and certain signs that I'm seeing. And it's funny too, because Kim and I will have meetings and she'll be like, you're doing really good, but there's a couple days there that
that's just probably not what you were seeing, or you just don't understand it yet.
Right. Huge learning curve. There's a learning curve.
There's a huge learning curve. But yeah, I mean, it is really, that's a really good point. You've definitely got to have a practitioner to hold your hand throughout the time, because, you know, Kim's been really supportive with like, okay, let's just not have intercourse for a couple of weeks so we can kind of figure out what's going on. Because if I were, like she says, I could have, you know, accidentally picked the wrong day and then whoops, ended up in a situation, because I'm obviously using it as a contraceptive to not get pregnant. So that would not be a good thing. Be going against using it the right way. So yeah, definitely using a practitioner is kind of the way to go.
Yeah. And I would add to that too, that if you can find a certified practitioner, and not all practitioners are certified, it's a super easy process to become certified. I used to be on the review board for certification. I question people who don't want to go through that process. I mean, why don't you want to be certified? That's like the next step in the process of being a good teacher. So not all practitioners are created equal, say it that way. So if you are somebody who has kind of a complicated situation or a complicated case, if there's not a certified person locally, you may want to try and find somebody that is, and you can find that online. If you're on Facebook, there's a Facebook users group, and there's a whole list of practitioners there, and that will tell you who's certified and who's not. And the medical consultants and doctors are also listed on the websites and on Facebook also.
Okay.
Yeah.
Cool. So people can look into that to find a, I guess, local practitioner.
Yeah, and you can always contact me. I have a master list.
Yes.
So can't find anybody else, contact me.
Yep. And of course, at the end of the show, we always want to get your information so people can reach out and contact you. Because I think that hopefully there's a lot of girls out here listening that are super into this right now and they want to get started.
I hope so. I'm sure there are. It's kind of not usually an issue to find people who need this information, for sure.
Yeah. So I guess another question, Casey, do you have any questions or anything real quick?
Yeah, I was a little bit more curious, Kim, about when you were talking about tracking and everything and figuring out if people do have hormone dysfunction or infertility. I don't know if it would just be too much information to give, but like, how do you actually know that? Or like, how are you able to pinpoint that by tracking? Is it based on the mucus?
A lot of it is based on the mucus, but it's also a correlation of the entire picture.
Okay.
So we kind of look at the whole thing from start to finish. You want to look for a healthy menstrual bleed pattern. Is that happening when it's supposed to, timeline-wise? Is the cervical mucus discharge the type of mucus that it should be to indicate good ovulation and fertility? Is that happening at the timeline that it should? And once you ovulate, is the length of the second half of the cycle good? You know, it should be about 2 weeks long. Well, somebody maybe with repetitive miscarriage, when they start charting, their post-ovulatory phase is only like 5 days. Well, why is it so short? And if they've got a pattern of that on their chart, we can visually see it and go, wow, your post-ovulatory phase or your luteal phase is really short. And that's an indicator of possible hormone dysfunction or ovulatory disorder or something like that. So whereas I can't diagnose people because I'm not a doctor, I have been trained to look for particular patterns. And so I can guide them on, you know, this phase is not looking like it should. So I would highly recommend that you go see one of our doctors who's trained in this, and they can uncover really what's going on and assess what you need. So there are patterns that will emerge in a person's charting.
Okay, that is so neat.
Yeah, it's really cool.
Yeah, just things that you wouldn't think of, just, I don't know. I mean, I guess because we're just so uneducated about our own bodies and knowing, oh, okay, here are the signs to look for.
I mean, I had a couple of young girls in their early 20s come to me, both of them, separate occasions. They opened their charts and their menstrual periods were over 2 weeks long. And I went, is this your normal pattern? Well, yeah, I always bleed for like 17 days. And I just went, oh, sweetheart, that's not normal. Like, I hate saying that I'm using that term, but that's not a normal bleeding pattern. Oh, I thought everybody did it like that. No, we don't. It should be maybe 7. It should be half or even more than half of what you're doing. One of them did have an underlying hormonal dysfunction. One of them, it was stress.
Oh, interesting.
Yes, stress is a big factor. And so we take a look at stress and its impact on cycles also. And for her, once her stress cleared up, her cycles regulated, her bleeding pattern became more normal. And I think she just had her 3rd or 4th girl.
Oh, wow.
So she was afraid, going into this, that she was going to have an infertility issue, a big infertility issue. And it just turned out that she needed to get her stress under control and manage her stress. And she doesn't have any issues.
Wow. That is so neat.
Really cool.
Mm-hmm.
It's crazy how things like stress and like your environmental factors, like toxins and heavy metals and all that kind of stuff, that can really play a huge role on your cycles as well.
Absolutely.
And then it's really cool how you can kind of track your cycles and look at these patterns and really figure out like the hormonal dysfunction going on. If there is a, pattern of infertility, that's just fascinating to me.
Mm-hmm. It is. It's really cool. That's why I love my job. Because it's really awesome to see people come in kind of at a low point and really frustrated with their bodies, especially those couples going through infertility. We've been there. I've lived it. I know what it feels like, and to kind of feel desperate and not very hopeful, and then to discover something. It's an interesting process because a lot of those people go through a period of anger. Why didn't anybody tell me about this before? We've gone through so many years of all this testing and all this money and all these treatments that didn't work, and this been here all along and no one told me. So there's that anger issue, and so we work through that, and then when it starts to turn around, and when really for people in that situation, it's when they finally have an answer to the why. Because so many people are told, oh, you have unexplained infertility. I'm sorry, but that's a cop-out. That's not a diagnosis. Unexplained infertility is not the diagnosis. Mm-hmm. There is something causing your issues, and usually it's multifaceted. Mm-hmm. So our program doesn't work as quickly because it takes time to sort this out and figure it out, but they always get their answer and usually get their baby. But some people don't, we're not miracle workers, but they know why they can't. And they just go, this is okay. Like, it allows them to heal through that process because they have an answer. It's closure for them. They can sit back and go, okay, well, I still really want a baby, but I don't know if that's in the cards for us. But I know that I am having trouble having a baby because I have this, this, and this. But my health has improved because those issues are being treated. Mm-hmm. So I'm way better than where I was when I first started this. So it's so therapeutic in many different aspects because it helps them understand what's going on.
Mm-hmm. Yeah, you make such a good point too about just people want to know the reason why. And it seems like just going through that acceptance phase of, okay, this is why we are unable to have children. And it just makes it, I don't know if easier would be the right word, but just in terms of accepting it and, okay, we know now why, and we can move on.
Yeah. And I tell people all the time, it's women's reproductive health is kind of the only part of medicine that's treated this way, where it's like, well, we don't really need to figure out what's going on here. Just take this pill and it'll cause you to not get pregnant and regulate your cycles. Well, which it doesn't really do at all because it's all pseudo hormones and pseudo cycles. That's a whole nother podcast. Mm-hmm. But they want to know the answers to those things, and they feel like they've bounced around from so many doctors who aren't giving them any answers. But why is women's reproductive health treated that way? You don't look at somebody who's just been diagnosed with cancer and say, well, you had cancer, so here's a pill. Like, no, we're going to treat this cancer. We're going to get it the best we can. We're going to get it out of your body and help you go on to live a long, healthy life and improve your health, hopefully, in the end of it. But women's health is like, no, we don't need to worry about that. We're just going to kind of suppress it all, cover it up, not really treat it, and we'll deal with you later kind of thing. And I don't understand that. I don't understand what happened to that aspect of medicine. Where did it go? Why aren't these doctors really working hard to practice medicine and improve women's health?
Mm-hmm. I think that's a whole other podcast too.
It is. I have a lot of different.
We're going to have like a 7-part series with you.
I know.
That's fine. I'm happy to do it. Yeah. There's a lot there, there's a lot contributing to this aspect of womanhood and, the way that it's looked at and the way that it's treated. And our system is going against all of that. It's not always an easy battle. Our doctors have a tough time. They're not accepted in mainstream medicine. I'm sure a lot of functional med doctors kind of have the same issues. That they don't do stuff like everybody else, and they get hounded for it. And they're not the ones out there making a lot of money for what they do because it's different. But it's good stuff, and it's the stuff that people need. And that's why we got to get the message out there and get these women in the right hands, the people to properly treat them.
Well said. Very well said.
Thank you.
Yeah.
Yep.
Well, this has been awesome, Kim.
Yes.
Well, thanks for having me. I could talk for days.
I know.
Not at all.
I think we're seriously gonna have to do part 2, 3, 4.
Yeah.
I don't know. We'll see. I guess we'll just have to start going on and see where we end up.
For sure. Yeah. I mean, I love what I do, and I love talking about it because I just feel like it's incredibly important. And again, there's many topics regarding all of this that we could get into for quite some time.
Yeah, most definitely. But we'll definitely have to do a follow-up because I want to dive deeper into your story and kind of what you guys have been through with, infertility and now kind of doing keto and just the whole, I would love to just dive more into it. And all kinds of other stuff, obviously.
For sure.
But this has been great. And so I guess just let our audience know, any recent publications or media exposure that you just recently, anything that they can, where they can find you, all that kind of good stuff.
Okay, awesome. The easiest place and the best place to find me is on my website. So it's www.f as in Frank, C as in cat, fortbend, one word, .com. Stands for Fertility Care Fort Bend. That's the name of my independent center. You can read all about the program there, look at the teaching schedule, the costs associated with that. You can book right online, super easy. I have a blog there, so my story is actually in written form. So if you want to read that story and our journey, it's there on my blog. Have some guest bloggers every once in a while, so there's some good stuff on there. I have a Facebook page, Fertility Care Fort Bend, so if you want to check that one out. I'm also on Instagram as FC Fort Bend. My Instagram is my little virtual baby board. So when you go into an OB-GYN's office, you have that bulletin board of babies they've delivered. I have my NAPRO Miracle Babies on my Instagram.
Oh, I love that.
When my clients have their babies, they send me pictures and I post them on the Instagram, and you can look at all the cute babies. And because I feel like they're my babies, a lot of work gone into it. So it's awesome to have their sweet little pictures up there and giving them some little NAPRO exposure and spreading the word a little bit.
That's great. Well, thank you. Yeah, awesome.
Well, thank you guys so much for having me.
Yeah, great. Thank you again, Kim. This has been wonderful. Such good information, and really just appreciate you taking the time to spread this out there so that more women can learn about this Creighton model, because it's definitely changed my life and made a huge impact. And I'm just so grateful that I found you and blessed that I'm now doing this. So happy we can get this information out there. Yeah,
I love working with you, Megan. It's awesome. So thank you so much for inviting me, and I'm happy to do anything else that we can come up with talking about, because there is a lot more we can dive into.
Cool. Well, everyone stay tuned, because we'll definitely have a part 2 to this. So for sure.
Yes. Thank you, Kim.
Thank you, Casey.